listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static. In today's episode, we've got a quick refresher on compliance and tips for best serving your clients. Medicare Advantage Open Enrollment Do's and Don'ts, written by Blaine Waterloo and Isabel Vitale. Picture this. It is Q1 and a client in a new Medicare Advantage plan gives you a call. They are concerned about their plan. Changing health plans can feel uncertain as clients transition from the known to the unknown. What happens when someone makes the move to try out a Medicare Advantage plan for the first time or switches health plans and then discovers their new coverage is not the right fit? Luckily for them, they're not stuck with their new coverage. Almost immediately after the annual enrollment period, or AEP for short, beneficiaries in Medicare Advantage plans have an option to reconsider their plan selection. We'll explore what you need to know about the Medicare Advantage Open Enrollment Period, or the MA OEP for short, and we'll go over important do's and don'ts that will keep you compliant. First, let's look at Medicare Advantage OEP qualifications. According to the Centers for Medicare and Medicaid Services, or CMS, the open enrollment period that most accurately applies to your clients hoping to switch plans after AEP is the MA OEP, if they qualify. The MA OEP is specifically for clients new to Medicare who enrolled in an MA plan during their initial coverage election period, or ICEP. These beneficiaries have a 3-month individualized OEP that starts with the month they are entitled to Part A and B. So, for example, if your client's Part A and B eligibility begins June 1st, then they have June, July, and August to make certain changes. For those who enrolled in an MA plan as of January 1st, they also qualify for an OEP from January 1st to March 31st. This means that your clients calling you in January who are unhappy with their new plan can make a one-time switch in coverage. What can they switch to? Well, they do have some options. Here are some key enrollment guidelines to keep in mind. Agents can use the Medicare Advantage OEP to switch a client from one Medicare Advantage plan to another MA plan. You can help a client drop their MA plan and return to Original Medicare. And should a client go back to Original Medicare, you can enroll them in a prescription drug plan. Keep in mind that your clients will not be able to change a plan more than once during this time frame. Agents cannot disenroll a client with Original Medicare from any accompanying prescription drug plans. If your client is enrolled in Original Medicare, you cannot try to enroll them in a Medicare Advantage plan. And then one last restriction. Clients cannot use the MA OEP to drop a Medicare Medical Savings Account plan. Remember, the MA OEP was created for those with Medicare Advantage plans already. This means that your clients in Original Medicare with a Med Sub cannot use the MA OEP as an opportunity to enroll in a Medicare Advantage plan. Furthermore, Part D changes are also limited and depend on changes to the Medicare Advantage plan. Clients can change their drug coverage by switching from one MAPD plan to another, by changing from an MA only to an MAPD plan, or by returning to Original Medicare and picking up a standalone Part D plan. Those with Original Medicare and a Part D plan cannot switch to another drug plan during the MA OEP. They'll have to wait for an SEP or the next AEP. How can you educate clients about their options to make changes? a big difference for agents between the AEP and the MA OEP is the restriction on marketing. Let's take a look at marketing do's and don'ts during the MA OEP. Agents cannot knowingly target or send unsolicited marketing materials to MA or Part D enrollees during the MA OEP, spanning from January 1st to March 31st. It's important to note that knowingly takes into account the intended recipient as well as the content of the message. We'll start out with what agents can do. You can host marketing events focusing on plans other than MA or Part D, such as appealing to agents who have not yet enrolled in a plan. Marketing based on the continuous special enrollment period beneficiaries have to enroll in a 5-star plan. Reaching out to dual eligible and low-income subsidy beneficiaries, since they can generally change plans once each quarter during the first 9 months of the calendar year. Send marketing materials to a beneficiary who makes a proactive request. Hold one-on-one meetings with beneficiaries who request them, and give out MA OEP information if a beneficiary asks for it. Here are things agents cannot do during the MA OEP. Send beneficiaries unsolicited communications about the ability to make any additional changes or reference the MA OEP. Target by way of purchased mailing list or any other means any beneficiary who's in the MA OEP because they made a decision during AEP. Participate in or advertise any agent broker activities that address the MA OEP as a means of making more sales. Contact former enrollees who chose a new plan during AEP, or use the OEP as an excuse to reach more clients you didn't get to see during AEP. Something else I do want to note here, if a beneficiary who has already made an enrollment decision unintentionally receives marketing information, it's not considered knowingly targeted. Here are some examples of things you should not communicate to your clients concerning the MA OEP. Don't like your new Medicare plan? Reach out to me about your disenrollment options. Did you know you can switch your MA plan from now until March 31st? Let's make an appointment. Huge red flags with those statements. They are not CMS compliant. Moving on to the effective date of coverage and beyond. Coverage on a plan chosen during the MA OEP begins the first day of the month following the month a Medicare Advantage company gets the enrollment request. For example, if a client enrolls in a different MA plan on March 3rd, their new plan's effective date would be April 1st. But please note that the company in question can decide whether or not they're open to enrollments during the MA OEP, which means your clients are not guaranteed a plan during this period. Make sure you know which of the carriers you represent allow enrollments during the MA OEP before making recommendations. That doesn't mean your clients are stuck if this is the case. They may be eligible for multiple enrollment periods occurring within this one. For instance, they may qualify for a special enrollment period. So it's possible their request for coverage will be accepted, but under a different coverage start date. Before we close out this episode, I want to leave you with something to think about. Take advantage of the window between the end of AEP and the beginning of the MA OEP. Reach out to your clients to make sure they understand their plans and that they're happy with them. Let them know you're available if they have any questions or need further assistance. By doing so, you'll provide your clients with a feeling of security, and as a result, they'll be far more likely to refer their family and friends to you. Remember, if you're not contacting your clients throughout the year, another agent may seize the opportunity to gain their trust. A client who has questions or is confused with their plan is far more susceptible to allowing another agent to write them into a Medicare Advantage plan next time around. Protect your business. Don't let the hard work you put into AEP go to waste. Here at Ritter Insurance Marketing, we are happy to help. If you have questions or concerns about compliance, sales strategies, or anything else industry related, don't hesitate to reach out. You can email us your questions at asgpodcast@ritterim.com or leave a voicemail on our hotline at 1-717-562-7211. We look forward to hearing from you. Thank you so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Blaine Waterloo and Isabel Vitale. Script adaptation by Tina Lamoureux. Recording and production by me, Sarah Ruppel. Podcast design by Urban Rivera. Artwork by Vivian Zhao. Follow along with our show wherever you like to listen.